Hello and welcome everyone to this highly informative video on the top 15 situational interview questions and answers for the position of Nursing Assistant or Healthcare Assistant, HCA, at the NHS. If you're aiming to secure this challenging yet rewarding position, knowing how to handle situational questions is crucial. In this video, we will cover situations ranging from emergency procedures to teamwork dynamics, all based on the real-world responsibilities of an NHS nursing assistant. So without further ado, let's begin. Segment 1. Emergency Preparedness. Question 1. What would you do in an emergency situation where you find a patient lying on the floor? Answer. First and foremost, I would immediately press the emergency buzzer to alert medical staff and request assistance from colleagues. While waiting for help, I would assess the patient's condition without moving them, to prevent any further harm. Once additional medical staff arrive, we would collaboratively determine the best course of action, whether that is stabilizing the patient for further evaluation or immediate transport to a more intensive care setting. This quick and coordinated response ensures patient safety and emergency protocol compliance. Question 2. What precautions would you take to prevent further falls? Answer. To prevent further falls, I would ensure the room is free of hazards, adjust the bed to a lower height, and possibly recommend the use of bed rails. Educating the patient and their family about fall risks and prevention strategies is crucial. Segment 2. Ethical dilemmas. Question 3. What would you do if you saw a colleague providing improper care to a patient? Answer. I would intervene immediately to correct the situation, ensuring the patient's safety comes first. Then, I'd report the incident to my supervisor and complete any required documentation, as per NHS policies. Question 4. How would you handle a situation that raises concerns about patient confidentiality? Answer. Patient confidentiality is of utmost importance. If a situation arises where confidentiality may be breached, I'd promptly report it to my supervisor and follow the internal procedures to rectify the issue. Segment 3. Infection control. Question 5. How would you manage a patient diagnosed with diarrhea to prevent the spread of infection? Answer. I would adhere to infection control procedures such as wearing personal protective equipment and isolating the patient. I'd also enforce strict hand hygiene practices for both staff and visitors while ensuring that all contaminated materials are disposed of safely. Segment 4. Teamwork and general duties. Question 6. Tell me about a situation where you worked within a team and how it helped you achieve a goal. Answer. Working in a high-pressure environment, effective teamwork is critical. During a code blue emergency, our team's swift communication and role distribution led to a successful patient resuscitation. This experience emphasized the value of teamwork in patient outcomes. Question 7. What are the main duties you would be performing as a nursing assistant at the NHS? Answer. My main duties would include patient care such as bathing, feeding, and monitoring vitals. Additionally, I'd assist in medical procedures, maintain clean and safe environments, and provide emotional support to patients and families. Question 8. Tell me a brief description of yourself and why you are motivated to this position. Answer. With a strong educational background and work experience in healthcare, I have honed my caregiving skills and am adept at stress management. The role of a nursing assistant at NHS appeals to me because it allows me to contribute meaningfully to patient care and be a part of a reputable organization. Segment 5. Safeguarding. Question 9. What would you do if you suspect a patient is at risk of abuse? Answer. Safeguarding patients is a top priority. I would immediately report my concerns to the designated safeguarding lead and follow the safeguarding protocols of the NHS, ensuring that the patient is protected from further risk. Segment 6. Professionalism and personal attributes. Question 10. How do you deal with stressful situations and high-pressure environments? Answer. In stressful situations, I rely on a calm demeanor and effective time management skills. I prioritize tasks based on urgency and patient safety, consulting with my team to make quick, informed decisions. Keeping communication lines open helps us operate smoothly, ensuring optimal patient care. Question 11. Describe a time when you had to adapt to new technologies or software in your role. Answer. I recall when our facility transitioned to a new electronic health record system. Though initially challenging, I took extra time after work hours to familiarize myself with the new software. My willingness to adapt helped me become proficient quickly, which in turn benefited patient care and workflow. Segment 7. Communication skills. Question 12. How do you communicate effectively with patients who are angry or frustrated? Answer. In cases where patients are angry or frustrated, active listening is key. I let them express their concerns without interruption and then provide solutions or explanations. If needed, I'd involve a supervisor to resolve issues, always aiming for patient satisfaction. Question 13. How would you approach a family member asking for confidential information about a patient? Answer. I would politely explain that I am not authorized to disclose confidential patient information to anyone other than those listed in the patient's care plan. I'd offer to contact a nurse or doctor to discuss their concerns further, always keeping the patient's privacy in mind. Segment 8. Miscellaneous. Question 14. What measures would you take to ensure you are always in compliance with health and safety guidelines? Answer. Compliance with health and safety guidelines is non-negotiable. I would regularly update myself on policy changes, engage in continuous learning, and adhere strictly to protocols like hand hygiene, proper disposal of waste, and use of personal protective equipment. Question 15. If you encounter a language barrier with a patient, how would you ensure effective communication? Answer. In such scenarios, I would utilize available translation services or technology to facilitate communication. If these are not readily available, I would use visual aids and non-verbal cues to convey essential information, while ensuring a professional interpreter is contacted for more complex conversations. Please click the subscribe button if you found this video helpful and want to stay updated with more professional guidance and tips for career advancement in healthcare.